Hello. The pharmaceutical industry, and particularly the medical affairs teams, play a pivotal role in shaping patient care. They are integral components of healthcare system. The medical team's influence and contributions are deeply embedded in the patient treatment and healthcare delivery. This central role underscores a fundamental truth. One cannot effectively work in healthcare, engage with healthcare professionals and patients, or contribute directly or indirectly to patient care without deep understanding of evidence based medicine, its various types of clinical evidence, and the hierarchy governing this evidence. Evidence based medicine is the cornerstone of clinical decision making, ensuring that treatments and interventions are not only scientifically sound but also tailored to individual patient needs. The types of evidence, ranging from randomized controlled trials to expert opinions, each play a distinct role in building a comprehensive understanding of medical treatments and patient outcomes. The hierarchy of evidence further guides healthcare professionals in evaluating the strengths and applicability of different research studies, ensuring that the highest quality of evidence informs patient care. For professionals in the pharmaceutical industry and medical affairs like us, this knowledge is a practical necessity. It informs every aspect of our work, from drug development, regulatory compliance, to patient and healthcare professional educations and clinical trial designs and interpretation of data. So, understanding evidence based medicine enables us to make informed decisions, put the right strategies, contribute to the advancements of healthcare, and ultimately improve patient outcomes. Evidence based medicine represents a pivotal shift in healthcare, emphasizing the integration of clinical expertise with the best available clinical evidence from systematic research. It's a practice that has fundamentally transformed medical decision making and healthcare delivery. As of its classic definition, at its core, evidence based medicine is the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. It involves a balance of three key elements. One, clinical expertise. This refers to the skills and experience of healthcare professionals. It includes understanding the patient's unique clinical circumstances and personal preferences. Two, best research evidence. This is clinically relevant research, often from basic sciences, but more importantly from patient centered clinical research. It involves studies and outcomes that are relevant to patient care. 3. Patient values and preferences, recognizing that each patient brings their own set of values and expectations to the clinical encounter. Evidence based medicine respects and integrates these individual patient concerns and expectations. If we look back to the history of evidence based medicine and how it evolved over years, we will know that the evolution of evidence based medicine can be traced back the mid 20th century. The concept of applying scientific evidence to medical practice has been around for centuries. However, it was not until the 1970s and 1980s that the term evidence based began to be commonly used. In the 1960s and 1970s, there was a growing emphasis on clinical epidemiology, which is the study of patterns, causes, and effects in patient populations. This laid the ground for evidence based medicine, and the term evidence based medicine was formally introduced in the early 1990s by a group of epidemiologists at McMaster University in Canada. They emphasized the importance of using empirical evidence to make clinical decisions. In the 1993, Cochrane collaboration was formed, focusing on systematic reviews of randomized controlled trials. And this was a significant step in organizing and disseminating evidence for healthcare decision making. The introduction of internet and digital databases in the late 1990s and early 2000s greatly facilitated the access to medical research, further propelling the evidence based medicine movement. And over time, evidence based medicine principles have been increasingly incorporated into medical education, emphasizing the need for new physicians to apply research findings in clinical practice. Today, evidence based medicine continues to evolve with the advancements in data analytics, personalized medicine, and a growing emphasis on patient centered care. It's not just about applying research findings, but also about integrating these findings with clinical expertise and patient preferences to provide the best possible care for patients. So, evidence based medicine has a triad of three pillars. Each of these pillars involves three components. Yes, evidence based medicine stands out as a harmonious blend of science and personalized care. At its heart, the triad exists, a three-part harmony that guides healthcare professionals in delivering optimal care. This triad consists of the best research evidence, clinical expertise, and patient values and preferences. Together, they form the cornerstone of effective and patient centered healthcare. The first pillar is the best research evidence, and this involves three components. It involves using current, well conducted research studies from clinical decisions. However, with stress on three components. The first are about quality and relevance. The emphasis here is on high quality studies such as the randomized controlled trials and systematic reviews, which provide reliable data free from bias. And the third component here is the continuous update. The field of medicine is ever evolving, with new studies and findings emerging regularly. Keeping abreast of this research is crucial for healthcare professionals to ensure they are using the most current and relevant evidence in their practice. The second pillar of the triad is the clinical expertise, which involves practical application. And this refers to the skills and experience of the healthcare professional, which includes their professional ways in diagnosis, treatment, and patient care. It also includes a very important component, which is the judgment and flexibility. It involves the ability of using judgment in applying research findings to individual patient cases. It recognizes here that each patient is unique and that clinical guidelines may not necessarily always fit every situation. The third component is lifelong learning. Because clinical expertise is not static, it grows and evolves and gets updated with experiences, ongoing education, and exposure to a wide range of clinical scenarios. So, lifelong learning for the healthcare professional here is a mandatory requirement to establish up to standard or up to level clinical expertise. The third pillar, an equally critical pillar for evidence based triad, is patient values and preferences. Patient centered care. This aspect acknowledges that healthcare should be tailored to the individual needs and wishes of each patient. The second component is informed decisions, and here it involves engaging patients in their healthcare decisions, ensuring they are informed about the options and the evidence supporting these options. The third component is the respect and empathy. Understanding and respecting patient values and preferences require a deep sense of empathy and communication skills. It's about building a partnership with the patient and healthcare provider. So, the evidence based medicine triad is a model of holistic care where the best medical research, clinical acumen, and patient centered approach come together. It's a dynamic and patient focused approach that ensures healthcare decisions are not only scientifically sound but also deeply respectful of individual patient needs and circumstances. For medical affairs in the pharmaceutical industry, the evidence based medicine triad is likely a guiding principle. It encapsulates the sense of modern healthcare as a blend of scientific, professional wisdom, and compassionate care. This triad not only informs clinical decisions but also shapes the way healthcare is taught and practiced, ensuring that it remains responsive, effective, and deeply human. So, knowing all this, we understand that evidence based medicine is a commitment to using the best available evidence in order to guide patient care. The importance of evidence based medicine in healthcare cannot be overstated, as it plays a crucial role in improving patient outcomes and impacting healthcare decision making. The role of evidence based medicine in improving patient outcomes, let's discuss this. Evidence based medicine integrates the latest and most relevant research into clinical practice. This means patients receive treatment that have been proven effective, leading to better health outcomes. Also, before evidence based medicine, treatment decisions were often based on individual clinical experience or local practice traditions, leading to variability in care. However, evidence based medicine provides a more standardized approach, ensuring consistency in treatment and reducing unwarranted variations. Evidence based medicine also goes beyond one size fits all solutions by considering the best available evidence along with patient preferences and values. So, it allows for more personalized and patient centered care. And by relying on well researched interventions, evidence based medicine helps in avoiding harm caused by ineffective or outdated treatments. This is how evidence based medicine can improve patient outcomes. What about the impact on healthcare decision making? Evidence based medicine equips healthcare professionals with up to date knowledge, enabling them to make informed decisions about patient care. This is particularly important in a field where new research and data are constantly emerging. Also, evidence based medicine helps in identifying treatments that offer the best value for money by focusing on interventions that are proven effective and safe. So, healthcare systems can avoid wasting resources on less effective options. And this leads us to talk about policy and guidelines development because evidence based medicine is instrumental in developing clinical guidelines and policies. These guidelines provide a framework for healthcare providers, ensuring that care is based on the latest and most effective practices. It also, evidence based medicine plays a role in patient education and empowerment. Patients today have access to more information than ever before, and evidence based medicine helps in providing them with reliable, research backed information to make informed decisions about their own health. That is to say, the significance of evidence based medicine in the healthcare sector is profound and multifaceted. It's a cornerstone of the quest for improved patient outcomes, more informed decision making, and a more efficient healthcare system. As healthcare continues to evolve, the principles of evidence based medicine will undoubtedly remain central, guiding clinicians and patients alike towards better health and well being. Now, let's shift gears and talk about the types of medical evidence and the hierarchy of evidence. Evidence is the cornerstone upon which clinical decisions are built. That's why understanding the types of medical evidence and the hierarchy that governs their reliability and applicability is crucial. crucial for medical affairs in pharmaceutical industry as well as for healthcare professionals treating patients. This understanding is not just academic, it directly impacts patient care and outcomes. So, what are the types of medical evidence? On top of the list comes the randomized control trials. These are often considered the gold standard in medical research. Randomized control trials involve randomly assigning participants to either the treatment group or the control group. This method helps eliminate bias and provides strong evidence for cause and effect relationships. And then we have the cohort studies. These are observational studies that follow a group of people, which here is called a cohort, over time to see how certain exposures affect outcomes. They are particularly useful for studying risk factors and natural progression of diseases. And then we come to the case control studies. These studies compare patients who have specific conditions, and here it is called they are called cases, with those who don't have, and here they are called controls. Looking backward in time to determine exposure for risk factors and others. Another type of clinical evidence is the cross sectional studies. These studies observe a defined population at a single point in time or over a short period, providing a snapshot of frequency and characteristics of a disease or a condition. Another type of evidence is the case reports and case series. They are detailed reports of the symptoms, signs, diagnosis, treatment, and follow up of individual patients. Case series are similar, but they involve a small group of patients, not an individual one. Expert opinion and consensus statements are also considered somehow evidence. While not empirical evidence, they are often form a consensus statements that can provide insights based on clinical experience when empirical evidence is lacking. So these are different types of medical evidence. And if we want to rank them in a hierarchy, the hierarchy of evidence is a system used to rank the strengths of research according to the methodological soundness and thus the reliability of the findings. From highest to lowest, it typically includes, on top of the list once again, the systematic reviews and meta analysis. These are top of the hierarchy. They synthesize data from multiple studies, providing comprehensive overview of a research area. And then comes randomized control trials. Due to their design, randomization, they are highly valued in the hierarchy for their ability to demonstrate causality and eliminate bias. Then, this is followed by the cohort studies, offering valuable insight, especially when the randomized clinical trials are not feasible. Followed by case control and cross sectional studies. These studies are useful for hypothesis generation but are lower in the hierarchy due to potential biases. Case reports and case series, while they provide detailed clinical information, they rank at the lower of the hierarchy. Expert opinions, this is considered the least robust form of evidence as it is based on individual experience and not empirical data. Understanding different types of studies, the strengths and limitations are also very important. So, in essence, randomized controlled trials are excellent for determining the causality, but can be expensive and time consuming. Cohort studies are great for studying the natural cause of the disease but can be prone to certain biases. Case control studies are useful for rare diseases but can suffer from recall bias. Cross sectional studies are good for determining prevalence but cannot establish causality. Case reports and series provide detailed clinical insights but lack the generalization. So that is to say that we need to understand different types of medical evidence and the hierarchy that governs this evidence. This is fundamental in the field of medicine and pharmaceutical medicine. It guides clinicians and researchers in making informed decisions, ensuring that patient care is based on most reliable and relevant information available. For us, we are deeply involved in education and the discussions with healthcare professionals, and it is not only good to have, but it's mandatory to know the types of evidence and the hierarchy governing this evidence. It is a practical tool that informs every aspect of patient care and medical education.